Welcome back to Business AM. My name is Simba Elijah Shalski again. I keep on saying this. The last part of Business AM is usually the most interesting. Despite you knowing and getting scared about what's happening in the economy, and for Kiambu County residents, guess what? You have no governor as it stands. It's now in law that once you're indicted with any charges, you have to step aside. We are following the proceedings of exactly what is happening in Kiambu County, and this case for Ferdinand Waititu and C.S. Rotich, and we shall be giving you updates on that if need be. This morning though, what are we talking about? We're talking health. We do understand that you really need your peace of mind. You need to be healthy in words for you to portray these at words. And business can be stressful sometimes. You have to manage losses, you have to manage numbers, you have to manage time. And for those who know, at Metropole Television, we are into business and the well-being of business. So this morning, we are not talking health in the sense of its contribution to the economy. No, we are talking health in the sense of you being healthy. And we're talking about stress and managing that stress. You should be thankful because this morning I am joined by Dr. Nyaga, Silas, and Dr. Naitoire from Riverdel Medical Center. Thank you very much for joining us.
Thank you for having me.
All right. Let's first define this very interesting topic called corporate burnout. Dr. Naitoire, I want you to pick it from there before we throw it to Nyaga. Yes.
Burnout is exhaustion. So this is exhaustion in the corporate area, in the corporate market, in the workplace. So that's what I would define as corporate burnout. Simplified, it's exhaustion. You get to the point where you are completely done. Can't move, can't function the way you're meant to function.
Yes.
Yeah.
We're going to come back to you. So, Dr. Nyaga, I just want to know, well, it is to the point that you can move. Somebody will tell you probably that I need to understand it deeper. How do you know that you can't move anymore? How do you identify that you have this corporate stress that we're talking about?
So basically, the main thing that happens is that you get to a point, there's a point where you're in a denial phase, where you're like in an okay zone, okay, everything is working well.
Yes.
And you don't share it with people. Then there's a place where you begin getting exhausted, but you say you have to keep on. Then you get to the danger zone now where you're completely unable to work, okay? And it really shows in the productivity of your work. So how you can really see that is that you find that people become really disinterested in their work, okay? The motivation goes away, and you find that the doubt, they begin having self-doubt in, was I supposed to be in this work?
Yes.
Or can I change another job?
Yes.
So they keep on, they want to move to another job, they keep on wanting to move to another job because now they're doubting what they really, where they are in terms of their workplace.
Yes.
Yeah.
Dr. Naitoire, I just want to talk about this in this sense. Are we now, therefore, talking about mental health, isn't it? Because when you look at stress, therefore, it is just the mental health of the people that work within this corporate. And you having looked at some of these cases, are people really aware that once I feel like this, I can move on, I feel like I'm stuck? That's energy-wise, emotion-wise. Are they able to recognize that therefore they now need help? And what sort of help is open now, especially from your side, of diagnosing this person and starting to make them recognize that this is actually corporate stress?
It starts with self-awareness. It starts with knowing your limits.
Yes.
And from many times, even just from talking with friends, it's you hear it, but it hasn't clicked yet that this is not okay.
Yes.
And so because
let's just come. You hear it. I know somebody will be listening to you right now and saying, well, what is this that you hear? And that why hasn't it clicked? Let's break it down further.
Okay.
So for someone who's listening to you right now with maybe I'm also in that line.
Yeah.
But I could be. Anyway, what are these things that you hear therefore but haven't clicked when you talk to them?
So one of the things that I would ask is, when was the last time you did something that you enjoyed? That you intentionally said, you know what, I love taking walks. I'm just going to take a walk just because I can. When was the last time you did something you enjoyed? But if your life is a cycle, you wake up, you go to work, you go back home, you sleep. It's somewhere in there you'll eat or not eat.
Yes.
Because some deal with stress differently.
Yes.
And so then if it's just a cycle and you cannot remember the last time you just sat and rested and got energized from resting, or then that's now what, for me, I say I can hear it from what people say. From when you're able to say, like what you're talking about, your life is just work, sleep, going home. Nothing in there is anything that would be enjoyable and profitable and beneficial. Yes, because also another thing that people tend to do is, I went and hung out with my friends and we just drank and got silly. And so that tends to be on the negative side, because then you're trying to cope. So it's not something that you don't wake up the next morning feeling energized. You wake up the next morning with a hangover.
I see now.
Yeah.
Isn't it?
Yeah.
All right, Dr. Silas, I want to take you back therefore to, I know you were mentioning states of this corporate stress. Would you just go highlight back before I come back to Dr. Naitoire, and therefore we start diagnosing these steps and knowing, okay, now when you hear this is exactly what it is that you're supposed to do, and when it gets to the worst level, therefore where and what are you supposed to do? Okay, let's first start with how these steps of recognizing this corporate stress. Are there identified steps that someone can listen to right now and say, well, I'm in step 1, I'm headed to step 4 or 5 if they're there?
So I'll just put it into 3 steps.
Yes.
Just to simplify it. So the first, you just begin feeling exhaustion. And exhaustion comes with emotional depravement. And the exhaustion, you can just look at exhaustion either physically, emotionally, and also spiritually. Okay, you just become exhausted completely. So you wake up that morning and you're feeling your muscles are really tired. Everything is just so tired in terms of the physical aspect.
Yes.
And then there's the emotional way out. There's maybe the interactions with your co-workers, so you begin feeling the total emotional way out. Okay. And then there's the spiritual aspect. So apart from the exhaustion, then you get to the cynicism aspect. Cynicism, CYNISM. So meaning that now, what I was trying to explain earlier is that the patient, the person begins experiencing the aspect that it's like. There's the cynicism, then they get to the doubt aspect. So the cynicism is where they're really not comfortable in the workplace.
Yes.
Okay. Then there's the doubt place. Now they begin doubting the purpose that they were, why they were brought to the workplace, or what they are expected to accomplish in the workplace.
Yes.
So those three steps, like when you just begin looking at them, because exhaustion comes first. Okay, then the cynicism, then the doubt aspect.
Yes.
So later on, that's the way you can break them again into phases. Those are like the indicators.
Yes.
Then you can break them into phases where you have now, where the phase, where I was trying to say about the okay zone, being in an okay zone.
Yes.
Then you get to a burnout zone. Then finally you get to the danger zone. Okay.
Yes.
So in the danger zone is like you can't completely work. Okay, so in the burnout, you're actually just working with minimal energy at that moment. You're saying, I'm going to be okay, I'm going to be okay. And maybe in a setup where you have to make ends meet, so you have to be there. Okay, so the people in the corporate world, they know they need this job, so they need to work. Yeah.
All right, Dr. Nthurima, I'm just going to approach this from a very pragmatic sense into what major companies like the multinationals that we know that operate within Kenya are doing right now. Just the other day we were reading headlines of Coca-Cola closing their Upper Hill branch and wanting to sell it, and then moving deeper into the state, and quote, they were saying, we want to make our employees feel like they're not in a work environment where you have to come in and then go to a very industrialized area, and then after that stick to the rules and get out, in that sense that they want to bring them close to homes so they don't feel the stress of having to, quote, fit in to this work environment, like let go of the work environment. Therefore, listening to Dr. Silas, therefore, what are the best ways, therefore, when you start feeling these stages, like, oh, I feel exhausted today, okay? How do you start mitigating this before you get to the danger zone where you're like, I'm not going to that work?
It will be baby steps.
baby steps.
Yes,
isn't it?
because by the time you're getting to that point,
Yes.
or even just looking back at your life for 1 year, it's been a cycle. It's been you've had habits.
Yes.
And so then what you do is just start incorporating little things in your day to day. So assuming you do enjoy walking, you know, that's some form of exercise.
Yes.
And but where you work, you know, you'll always have to either take a matatu or drive.
Yes.
So there's some form of transport, vehicle transport that's required.
Yes.
So then it could be something that in the evening you get off at a stage earlier.
Yes.
And just take those 5 extra minutes walking home and use that to calm down. Or it could be that for those who believe in praying, it could be that you just wake up in the morning and the first thing you do is pray instead of pick up your phone to
Yes.
check your emails. It could be that you maybe somebody else enjoys singing, so then why not just sing? And it could be in your bathroom. It could be you just join, a church or whatever else do something. Start making steps, and then also start talking.
Yes.
Start bringing in people and letting them know, hey, I'm starting to feel heavy. I'm starting to feel low. I'm not enjoying what I do anymore. I don't remember the last time I smiled,
Yes.
sincerely smiled. I don't remember the last time I genuinely just sat down and enjoyed sitting down and not felt like I was not doing anything.
Yes.
I was being lazy, because that also mentality, attitude change needs to come into.
Yes.
Yeah.
Dr. Nyaga, do you find, because I know you're now receiving, and is it okay for me to call patients therefore?
Yes.
It's okay.
Patients and clients.
Do you believe that in Kenya, when you tell your corporate that I am actually sick, in this sense, no malaria, not a cold, not anything, man, I'm going to receive an injection over.
Yeah.
Do you think we've accepted the fact that yes, we need to define the stressed people in our corporates as sick people? Have we gotten there where it's okay for me to take leave because, guys, I'm stressed? If I come to the question, what has it been so far? When you talk to them, what has been lacking? And I want us to lay this conversation basing it on Nairobi itself.
Yeah.
We don't know exactly the way Nairobi operates. It is move from point A, point B, it's fast-paced. Even when you're going to rest, even before you get to rest, there's already stress in between point A and B.
Yes.
People sleep 4 hours in Nairobi just because of traffic jams.
Yeah.
People wake up very early in the morning just because you want to beat that traffic before you get into the CBD. People never get to see their kids because you're waking up in the morning when they're sleeping. By the time you're coming back, they are already asleep. Isn't it? So when you look at these factors, therefore, do you think that our environment, especially in Nairobi, when you look at the corporates that exist within Nairobi, would you blame it solely on our operating environment that has led to this sickness? Especially when they're diagnosing a patient, you'll say you are stressed because of A, B, C, D. But therefore, when you look at the general operating environment in Nairobi, would you say it's a major causal factor when it comes to stress, corporate stress?
So I think you've put out 2 questions. There's one you've said is, can stress be equated to sickness? And then there's the aspect about the environment.
Yes.
The town-based environment. So we can't really say stress is equated to sickness, okay? Because when you talk about sickness or disease is a process, okay?
Yes.
And stress is, you're talking about, you have either internal factors or external factors. And so in the aspect that if you remove maybe the external factors, this individual is able to cope. Okay? And maybe if you remove the internal factors, this individual is able to cope. So stress can be a contributing factor to lead someone to a particular illness, okay, as an additional but not a very strong, significant in terms of studies that you say, okay, now if I have stress, then I have this particular condition.
Yes.
Are you getting? That if I say you're stressed with this job, then you have a particular condition. Okay.
Yes.
But it can create an environment in your body where you can be able to get to a particular certain sort of disease.
Yes.
Then the aspect is that when a patient comes and they say they are feeling stressed from work and everything, sometimes they're also in the psychiatric arena, you have the somatoform disorders where some patients do not have, you investigate them completely, they really don't have any medical basis as to what they are feeling. So someone comes and says, I have a pain here, I have a pain everywhere, and everywhere, you know. And if you look at it in the medical arena, they can't really say that this is a particular illness,
yes,
or this is not. Okay, so some patients begin presenting that way, in which we call now the somatoform disorders, and there are so many. If you broken down, So that's the first, okay? That's the first question. The second question that you've asked is in terms of the environment. So if you look at the environment, yes, you in the town-based environment, and yes, everyone is a lot of pacing and everything, and then there's also the work environment, okay? So for me, you look at what can you change, and what can you not change.
Yes.
Okay. I cannot change Nairobi, okay, as an individual, okay, because you have to look at that. I cannot change Nairobi. I cannot begin coming and just changing everything, how it runs and everything. But how can I cope now in the work environment? Okay, so you need to also look at the right coping mechanisms in the working environment. Yes, the manager can bring the aspect that he can get into a role where he creates a good environment for the workers to feel appreciated, maybe through performance appraisal, a good working environment where there is able to a communication either horizontally or vertically, a good communication aspect that can work, okay? But then also you as an individual, you need to come to your stand and say, what can I do as an individual to cope with this work environment? Okay, so different coping mechanism. Unfortunately, now people go to so many other diverse coping mechanisms now where they get into substance abuse, but it is just a temporary relief, and it actually now pulls them much deeper into the stress situation, and it gets even more worse and worse.
Yes.
Yeah.
Dr. Naitoire, and I know you've spoken to patients now, right? So it's okay now for me to call them patients. When you've spoken to patients, therefore, of corporate stress, would you say that we, as a corporate world now, have started to therefore recognize that we need to talk to doctors like you on exactly it is that we're feeling, therefore, to get help and to be aware that you need to do A, B, C, D when you're in such a stressful situation? Are we accepting, therefore? Because one of the major areas that mental health care is lacking in Kenya is just the whole aspect of we as Africans don't recognize stress, depression as a form of illness. In fact, for a long time now, it's been viewed as a weakness.
Yes.
Where you find that I can go to a doctor right now and start telling them that I'm stressed. Because, I mean, how is it supposed to happen? Are we moving towards that area where we're saying, well, corporates and the people working in the corporate sector in Kenya, yes, they're recognizing and they're coming to us for help?
From my own experience, just having worked in the corporate sector and where I am now, there is a definite it's slow, but there is a definite shift in terms of people recognizing that, hey, I can. It's okay to go and talk to somebody.
Yes.
It's not where the other America is.
Yes.
But there is a move. There is a small change where people recognize that, okay, yeah, I'm not okay, and this is not okay, and I can go and talk to someone.
And so when you look at the people, when you look at the demographics of the people that you've actually spoken to, do you find that the millennials now who find themselves in the corporate sector would come to you more often as opposed to the people who are not millennials, therefore? Because now this stress could be viewed as an issue that millennials will say, yes, I'm stressed and I'm not coming to work just because of stress.
Yeah, there's a definite age group, that is more open and to talking about stuff, to talk about these things. And there's an age group that hasn't quite gotten there yet. And a lot of it is just attitude change, mindset changing, in terms of, okay, stress is dangerous. There's a positive stress that actually motivates you and allows, and like athletes, they are under so much stress, they put so much strain on their bodies, because that's what stress is. It's a strain, but prolonged strain is not okay. So prolonged adrenaline rush, continuous, that you're constantly running, we're not made to do that. We're made to actually stop and rest and pace ourselves and enjoy, the breeze and all those things that we don't get to do because we're running after the shilling, the next shilling, the next 1,000 shillings you can get there, the next, I can't be seen to sit down. So when it comes to the point where we change our mindsets, that it is okay to sit, you're not being lazy, then there will be major differences as well. Then it will be, I'll be more open in saying, you know what, I am stressed, and going to your boss, going to your supervisor and saying, may I take tomorrow off because I just need a break. And it's not that I don't need a doctor's note, that I genuinely just need a break.
Just a slight
just 1 day break.
And that's somebody who's self-aware.
Yes.
Isn't it?
Yeah.
And recognizes that stress is a condition that would affect my output here.
It affects everything, not just, it affects everything.
Yes.
Yeah.
All right. So, Dr. Nyaga, people will talk about this and then they will like, maybe sometimes I get stressed, sometimes I'm good, sometimes it affects me, sometimes it doesn't. It's neither here nor there. What are the worst cases you've seen of people, therefore, who've just let it go without managing it? And then I'm talking about the danger zone. What are the worst cases, therefore, you've seen of corporate guys in the danger zone?
So there's normally it's a phrase that says, as a man thinketh, so is he. So when you think about it, starts always with a thought process. And now when it gets now to that danger zone aspect, the aspect is that you get led towards the like you mentioned, depression.
Yes.
Most of the people keep on saying, I'm depressed, I'm depressed, I'm depressed. But actually when you come to the clinical state, depression is much more heavy than the way someone may just experience a particular sadness, maybe a particular sort of small frustration. But depression takes almost a month to actually really develop to when you say someone is really in a state of major depression.
Yes.
Okay.
Yes.
So it keeps on pushing people to that direction most of the times. It mainly pushes people towards the psychological and the psychiatric manifestations. Not really, okay, when you mention psychiatric, people just think of going crazy and stuff like that, but not really necessarily. So you can have this minor sort of depression, and you can also have the major type of depression. So that's where people can be pushed or towards maybe some more of anxiety, okay? But in terms of the other illnesses take time before they really develop and really correlating to stress as a core issue.
Yes.
Yeah.
Okay. As we clear, Dr. Naitoire, what responsibility therefore? Because you've said that the response is not there, but it's a bit slow. Is that you realize that for a long time therefore, that as a country, and this is in public domain, is that our mental health has been neglected for some time. And it's now that we're realizing, so there are a lot of issues under mental health. There are a lot of depressed youth out here, that we have people go to work, but you talk to them, they're really stressed to the point that the outputs are getting affected. Since today we're looking at corporate stress, therefore, and burnout, what responsibility should the corporates, therefore, play to make sure that some of these cases we're talking about, therefore, are, number one, getting looked into, and number two, getting properly managed? What is this responsibility that they should play?
Those with businesses, those with companies, those in top leadership, those in top management positions, it would start with them realizing that it is important to rest, and then incorporating that into the culture of the organization. And when that becomes part and parcel, when I feel okay to say, hey, I need a break, then, and my boss supports that and knows my work output and knows that I'm not just faking it, but I'm actually genuinely I need a break. Then my trust and my loyalty to that organization increases. My productivity will increase because I'll come back energized. And so when organizations start getting to know their employees, genuinely knowing their employees, making it a point to sit to find a ways to get to figure out, hey, Naitoire, you've been working, you haven't taken leave the whole year. This is November now, the whole year you haven't taken leave. What's going on? How's your family doing? How are you doing? And somebody just takes that interest. So when organizations start putting that in place in one way or the other, then that starts, that's one of the ways to enhance your employees, enhance loyalty, enhance productivity, bring about a difference in culture. within that organization. And
Yes.
you go much further. When you're well rested, you think better.
Yes.
When you're well rested, you communicate better.
Yes.
When you're well rested, it's less likely that you will snap at somebody.
Yes.
So even conflict within the, amongst teammates in the office place will reduce. In terms of people feeling like they need to fake genuine, I'm in the hospital so they can get a break, will
isn't
also
it?
decrease.
Yeah, also start decreasing.
Those
Yes.
drastic excuses that we go to, where that will also start to decrease. Honesty will increase, integrity will increase. So it's very important. And one of the things that we even at Riverdel are into is just quality healthcare and family,
Yes.
and recognizing that when I am okay,
Yes.
then my family will also, because I'm okay, I will be able to be there for my family,
Yes.
and move on that. Yeah.
All right, now, this is the last thing that we're going to say. Since Riverdel now, you guys seem like you recognized this aspect of corporate stress. If they want to talk to you, how can they get you? Where you based? And anything that you can use, therefore, to get these guys to come to you and talk to you. Right. Yes.
So Riverdel, we're opposite Nakumat Lavington.
Yes.
And also she'll add on in terms of on the locations. And so in terms of getting the core values that we really emphasize in Riverdel is that there's compassion, integrity, those are the main core values that we try to encompass in Riverdel, so that and try to create a family sort of setup for our clients when they come, so they can feel welcomed and they can be able to get that quality time with the doctor. And because sometimes when the patient comes, they, as you're saying, they can, apart from the particular illness that could have brought them, they also have different stresses that are in life. So we have our counseling area that someone can also get in consultation with, so that they are viewed in a holistic type of manner.
Yes. Dr. Naitoire, 10 seconds as we clear.
We are based at Nasha Drive in Lavington, and we have OBGYN specialists, we have pediatricians, we have dentists, we have all form of healthcare. So outpatient services is what we offer. So, and we open 7 to 7, Monday to Friday, and then we also open Saturdays and Sundays as well.
Welcome.
Yeah.
All right.
So everybody's welcome.
Thank you very much.
Yeah.
You might find me there as one of your first patients looking for Dr. Naitoire.
Karibu sana.
Anyway, this morning we've based our conversation on exactly what corporate burnout is. I was joined by Riverdel medical experts, that Dr. Nyaga, Silas, and Dr. Naitoire, who really talked us into exactly what you need to understand when it comes to your working environment and how that impacts your daily output. And it's coming out that it's not just daily output, it's exactly you as a human being. Good. We are live on YouTube. One of these conversations are going there immediately, so you can go back and get these conversations. Talk to us at Metropole TVKE, #BusinessAM. You can get me at @Charles_Kiage. My name is Simba, Elijah Charles Kiage. I'll meet you at 1 p.m. for Metropole Business News at 1. Good morning.